Good morning.
You know, the city of Milwaukee's Common Council is considering re-implementing a mask mandate. And as we just mentioned, the city's now providing free N95 masks to residents. So I want to ask you, in your professional opinion, what would be the impact of another mask mandate right now? And is it really worth bringing back?
So what we know definitively is that mask mandates or more people wearing masks slows the transmission of COVID-19. And what that might do is decrease the rate of hospitalizations to local hospitals who are overwhelmed and really unable to take additional patients. So that could help us create enough breathing room in hospitals where other patients with, say, heart disease, neurological emergencies, cancer could get their care when they need it.
Understood. And we also know that some elected officials here in Milwaukee also want to see at-home test kits provided by the city. It also sounds like the Biden administration is working to set up a program to mail at-home test kits to American families. So what's the deal? Because we've heard that maybe these at-home test kits are not as effective. So can the results of these at-home tests be trusted?
I think perfect can be the enemy of good. And it's true that these PCR tests do a little bit better job as far as detecting COVID-19. But these at-home test kits, especially if used in people who have symptoms, perform pretty well. And there's a lot of folks who are wondering before they go to an event, maybe visit family, am I positive? Am I not? Others who find the long lines for testing just a little bit too bothersome. If they could do home tests, that could let people know that they are positive, and they'd likely make different decisions about going out into public if they knew the result of that test.
And we also know conversations about COVID are once again dominating school board meetings all across our area. There's talks about requiring masks in the classroom, talks about virtual or remote learning as opposed to in-person learning. Is it safe for kids to be in school right now? What should parents consider about the surging cases?
I think you can make schools safe, but it takes a lot of work. The first thing that has to be there is a mask mandate that's enforced. If our kids are unmasked in school in close proximity with Omicron and how contagious it is, not only will a lot of those kids get sick, but their teachers and the other professionals helping keep the schools open are likely to come down with COVID, and you'll have difficulty keeping that school open just because you have no staff. Otherwise, you want to, mind that distance a bit, try to keep those kids a little bit separated, and really encourage vaccination amongst those school-age kids. We know that that significantly decreases the rate of transfer of this disease. So you can have school in person, but it takes some work.
Dr. Pothof with UW Health is here live with us. And I also want to ask you, there seems to be a bit of confusion around some of the guidance from the CDC regarding isolations and quarantines. First, it was 10 days, then it was cut to 5 days. And now there's talks about a need for masks or a negative test after those 5 days. Can you break down that guidance from your perspective? What is the CDC saying families here in Wisconsin should be doing if they test positive for COVID?
Yeah, I agree. I think the guidance has been a little bit confusing. My guidance is that if you have COVID-19 and you still have any symptoms, you don't come out of quarantine till at least day 10. If you have no symptoms whatsoever, you're completely asymptomatic. At day 5, I suggest you take a rapid antigen test. If that test is positive, isolate till day 10. If that test is negative, then it's okay to go back in public, but you have to wear your mask all the time until day 10.
All right, Dr. Pothof with UW Health, thank you so much for waking up early with us.